attacking the people caring for those most in need. Syrian forces are accused of deliberately targeting hospitals, doctors and nurses. At risk, under fire and perceived as the enemy, this is Inside Story. Hello and welcome to the program. I'm Mike Hanna. Shocking new information shows the extent of attacks on medical facilities in Syria, and government forces have been accused of carrying out most of them. Physicians for Human Rights says more than 460 health professionals have been killed during the three-year conflict. The group says this is creating a health crisis that will haunt Syria for years. James Bays has this report from New York.
A blatant breach of the rules of war. A children's hospital in Deir ez-Zor deliberately targeted and badly damaged. The Geneva Conventions protecting medical staff and facilities in times of warfare have existed for almost 150 years. But the most comprehensive survey of attacks on medical facilities in Syria reveals they are now being completely ignored.
The medical personnel certainly are in incredibly difficult circumstances. I've spoken with doctors in the field that are covering many different field hospitals. There may be only one doctor in an area that's treating hundreds of people. We know in homes there are 3 doctors working in homes. Before the war there were 800.
These pictures show an attack on a hospital underway. Opposition fighters filmed themselves as they targeted the Tishreen hospital in Damascus, but this latest research shows the vast majority of violations were not actually by the opposition side.
Is there a clear picture of which side is responsible for most of the attacks?
Well, as you look at this map, you see a lot of blue circles, and the blue represents the government. 90% of the attacks have been committed by the government, by the Syrian government.
We spoke to one Syrian doctor who's currently in a neighbouring country by Skype. He did not want to be identified.
From the day one of the Syrian revolution, Syrian doctors were targeted by every means, being killed, being arrested, tortured. They were struggling every day to be committed to the oath they have towards their patients.
The picture this report presents is one of numerous violations of international law, leading to a situation where very many Syrians have virtually no access to basic medical care. Things continue to get worse. This year alone, 49 doctors killed, 14 medical facilities destroyed in the last month. James Bays, Al Jazeera.
And a little later in this program, we'll be looking at the resignation of the UN Special Envoy to Syria, Lakhdar Brahimi. First, though, to discuss the attacks on medical facilities, we have in New York, Susannah Sirkin, Director of International Policy and Partnerships and a Senior Advisor for Physicians for Human Rights, the organization behind this latest report. And in Chicago, Dr. Zaher Sahloul, President of the Syrian American Medical Society, who was recently in Syria providing medical relief. Welcome to you both. To begin with, Susannah Sirkin, looking through this report, the first thing that strikes one is that what is being revealed here is not really the fog of war, it's actually a conscious strategy. Is that what you see in this research?
Yes, absolutely. It's truly shocking and disgraceful, but in fact, what we have documented over 3 years and presented via this graphic, a map that shows how month by month, year by year, largely the Syrian government has deliberately and systematically and repeatedly targeted doctors and other health professionals, many of them for death, some through arrest, torture, and execution, and others by deliberate shelling and bombing of hospitals, as well as the deliberate assault as a strategy of war on health facilities and health care overall.
Well, Dr. Sahloul, your view on this report, are these details that you, of course, know about, but this issue that it is a decision, that it is a strategy, it would appear, and that 90% of the attacks, according to the research, are being carried out by government forces.
What we're seeing and what we're hearing from our colleagues in Syria, that these are systematic from the beginning of the crisis in Syria. Actually, the numbers that are included in the report are an underestimate, because many of the attacks and the targeting are not reported. Because physicians and hospitals are fearful that if they report an attack, next time they will be targeted even more. My colleagues told me that the ones who were detained and then released, that the government authorities are asking them, why are you treating the other side? So to the government authorities, a physician who is treating a wounded person who happened to belong to civilians or families or members of the opposition, then he is considered a criminal, which is of course against international and humanitarian law. We're seeing a destruction of the healthcare system because of this systematic targeting of healthcare facilities and physicians in Syria.
Well, Susannah Sirkin also pointed out in the report is that certainly within the last year, this perhaps indeed disturbing that the opposition has also been increasingly involved in attacks on medical facilities. Out of the 10 attacks that are documented, some 9 attacks have happened within recent months. There appears to be a retaliation, a counter-campaign. The strategy is spreading from government as well to opposition, which intensifies the problem, does it not?
Yes, well, our report and our documentation, which Dr. Sahloul is correct that it is a very conservative estimate, because we didn't even factor in attacks on military hospitals or the many temporary field hospitals that are providing life-saving treatment to the sick and the wounded in various locations as populations move across the country. But our documentation shows that 90% of the attacks have been carried out by government forces, but indeed that means that 10% are documented to have been carried out by various opposition forces, and you're correct that our documentation shows that these have been largely during the past year and have continued into 2014. And of course, they are equally violations of humanitarian law, of the Geneva Conventions, and they are crimes as well. And just because one side of a conflict overwhelmingly violates human rights and basic humanitarian principles, certainly does not give license to anyone else involved in the conflict to do the same.
Well, Dr. Sahloul, we're talking about statistics here, but it's flesh and blood. It's people, health professionals like yourself, caught increasingly in the middle. You were in Syria in recent weeks. Give us a sense, and you took some photographs, give us a sense of what it is like to be a medical practitioner caught essentially in a battle between opposing sides, attempting simply to do the job that you are sworn to do.
Well, actually, this is a very important point to highlight, that as physicians, we swore in our graduation, the Hippocratic Oath, that will be treat everyone regardless of their affiliation. And that's what the Syrian physicians are doing. They're trying to treat the wounded no matter what's their affiliation. I was in Aleppo 3 weeks ago, and the second day of my medical mission, I was called in the morning that one of the hospitals that we are supporting and helping was bombed, and there were 2 barrel bombs that were thrown in the hospital. And I went there to inspect the situation, and in my way to the hospital, there was this surreal scene where you have civilians and families and children pointing to the sky to a helicopter which was flying above the hospital and trying to discharge another barrel bomb. I went there and I took some pictures. The upper 2 flights of the hospital were destroyed completely. The medical staff were, shaken, and they were very distressed. They evacuated the patients. Fortunately, no one was died. There was one patient who had a surgery one day before, who had injuries from flying glass. But that was a very traumatic experience. Of course, that hospital was closed and out of service, and the neighborhood around the hospital right now is not benefiting from the services provided by the hospital. This is happening on a daily basis. I just have an email today from one of my colleagues in Aleppo who told me that he's writing this email knowing that at any moment a bomb will be dropped at the hospital and he may be killed. Physicians in Aleppo and other parts of Syria are crying and they're asking for help, not only to protect them, but also because they want medical supplies, they want medications, they want anesthesia medications and the surgical supplies so they can treat their patients. And this is not happening because of this security situation and the fact that any hospital that is perceived by the government to treat the other side is considered a hostile target.
Well, there has been a UN Security Council resolution, Susannah Sirkin, Resolution 2139, passed in February, calling for increased humanitarian aid and for all sides to give access to this humanitarian aid. This has been observed purely by ignoring it. What more muscularity can be added to create an accountability for these acts and to get humanitarian aid into those who clearly need it?
Indeed, this is really an outrageous situation. The United Nations Security Council voted unanimously in February to demand humanitarian aid access, medical care, food, supplies into Syria. And to date, we are still seeing cities under siege and obstruction of aid, which are grave breaches of the Geneva Conventions. They're serious war crimes. Physicians for Human Rights is calling these crimes against humanity. And the governments of the world, and especially the governments that sit on the Security Council, must figure out a way to use as robust diplomacy as possible to negotiate this immediate humanitarian access and a cessation of continued attacks on health and hospitals and clinics and health workers. We are also calling, of course, as we have been for many, many months, and it's long overdue, for the situation in Syria to be referred by the Security Council to the International Criminal Court, because these are grotesque crimes of war and crimes against humanity. As we know, both Russia and China on the Security Council have blocked such a referral. We know that this is not likely to happen, therefore, anytime soon, but at least the world assuring that it's understood by every government in the world that these are outrageous crimes and must be stopped is extremely important. We are very concerned about the spread of infectious disease. As many know now, we've seen a rise in polio, an alarming epidemic, as well as other infectious diseases, which were at a much lower level in Syria prior to the war, such as leishmaniasis. This is a public health disaster, not only for Syria and the Syrian people, but for the entire region and beyond. It must be treated as an alarming international security situation.
Well, Dr. Zaher, Sahloul, we heard their mention of the increase in infectious diseases. The World Health Organization recently highlighted the issue of particularly polio occurring in Syria, something that everybody thought had been dealt with years and years ago. So it is clearly a regional issue, not just on a political matter, but also on a health matter. And yet the international community appears incapable, if not unwilling, of addressing this directly. For a start, surely there should be some accountability for these acts against medical personnel, people who are simply attempting to save lives within an impossible situation.
Oh, definitely. I mean, we're talking about 50% of the Syrian physicians fleeing Syria over the past 30 years, according to the World Health Organization. 15,000 doctors have left Syria forced to flee because of these targeting attacks. This is not a small number. Most of these physicians will not be able to go back to Syria in the foreseen future. Most of them will settle in Europe or United States or the Gulf state and will not help the population that are in much need. You're talking about polio crisis. We're talking about hepatitis crisis. We're talking about measles resurfacing. We're talking about many of the diseases that disappeared in Syria coming back. And also we're seeing the same pattern in Iraq and Lebanon and in some of the neighboring countries. So this is a regional medical disaster that needs to be addressed, and the United Nations Security Council has the responsibility to make sure, first of all, that we have medical relief and humanitarian aid to areas like Aleppo. Aleppo is the largest city in Syria. There's only 300,000 400 physicians left out of 5,000 physicians. Only 3 orthopedic surgeons that are serving 2 million people in that trapped between the government and the opposition battalions. So this is an emergency that the international community has to address. We cannot address it in SAMS. Other NGOs cannot address it. We can do what we can do, that we can send medical missions, we can send medical supplies, we can help, we can advocate, but the United Nations Security Council has to take this responsibility and make sure that their resolutions are translated into action.
Susannah Sirkin, what can be done now to attempt to alleviate this crisis, not only within Syria, but clearly beyond its borders as well? Hundreds of thousands of Syrians are fleeing the conflict into neighboring countries.
First of all, I really want to applaud the courageous doctors in Syria who have risked everything, and many of them their lives, to treat their fellow citizens from whatever side of the conflict they're on, and especially groups like Dr. Sahloul's at SAMS. It's incredible work. So first off, supporting the humanitarian aid requests, including by OCHA, the UN, Ban Ki-moon. The governments of the world have not responded to the financial request for emergency humanitarian aid to Syria. It's the single largest movement of peoples in a crisis with extraordinary humanitarian need, including in the bordering countries. So those countries that have accepted refugees, we are making a strong appeal that they be kept there, that they not be turned back. That includes the efforts of Jordan and Turkey and Lebanon to safeguard and hold citizens of Syria who have had to flee. But there needs to be a much more robust response from the international community to help all of those who have fled. And then there must be a diplomatic solution, an enormous pressure, really, on the government of Syria and any opposition forces who are obstructing aid, so that corridors of relief can be immediately opened to end the siege of Homs, to enter Aleppo and treat all these people. I want to emphasize that in Aleppo, for example, just 2 months ago, a missile attacked a major hospital in Aleppo. And we know that the weapons that have been used by the government are weapons that are targeted. They are missiles and car bombs and ways of attacking and using weaponry that can be guided and can be directed. So we know that these attacks continue to be intentional, and we actually know that Syrian officials have acknowledged openly that they've succeeded in attacking a hospital. That's breaking a centuries-old taboo. It's immoral, it's inhumane, and it's a gross violation of the laws of war.
Well, that diplomatic resolution you mentioned is something we'll be discussing now. But at this point, my thanks to our guests, Susannah Sirkin in New York and Dr. Zaher Sahloul in Chicago. I'd like to turn now to what UN Secretary-General Ban Ki-moon is calling the failure for all of us in the face of the world's worst humanitarian crisis. And that's the resignation of the UN envoy for Syria, Lakhdar Brahimi. The veteran diplomat follows in the footsteps of former UN chief Kofi Annan, who resigned from the same job in August 2012. Brahimi expressed his regret at not being able to do more to help the Syrian people.
Apologies once more that we haven't been able to help them as much as they deserve, as much as we should have, and also to tell them that the tragedy in their country shall be solved. They have shown incredible resilience and dignity. They should continue to work. You know, the immense majority of the Syrians want peace and stability in their country, with their rights, of course. And I'm sure that they will get it.
Well, to discuss this, I'm now joined from London by Michael Stevens, Deputy Director of the Royal United Services Institute in Qatar. Welcome to you. We've just heard the disturbing, terrifying stories of what is happening to medical services within Syria itself as part of, according to that report, a conscious strategy being conducted by the Syrian government, but also by opposition groups. Now we have the resignation of the Arab League UN ambassador. what is going to happen to the little process that had been underway to this particular date?
I think that it's not that surprising that Lakhdar Brahimi has taken the decision that he has. I don't think anybody thinks that he didn't take on an extremely difficult job. The fact that he's lasted as long as he has is quite surprising to many. I think it's probably one of the most difficult jobs in the world to do, to place himself in between the warring parties in Syria and amongst the warring factions within the opposition themselves. It's a fruitless task. It requires an awful lot of energy and time, and I think Mr. Brahimi has come to the conclusion, or certainly did a couple of weeks ago, that there was not much hope left. Now we have to look for a replacement. I think much like the Israeli-Palestinian process, where talks keep breaking down, there are many people, particularly in the US, that love to have the idea of a talking process. For them, it gives them some kind of hope that there will be a better future. I question that particular line of thinking, frankly. I think it gives people false hope because some of the macro problems in Syria actually don't lead us towards a situation where there can be a negotiated settlement at this time, much like the Israeli-Palestinian conflict. So right now, we need to find someone to replace Lakhdar Brahimi, and then someone's going to have to come up with a new framework for talking.
Well, also, we've just heard from the Russians, from the Deputy Foreign Minister, saying that there should be no pause in the political process. Positive dynamics that have been created to this point must be safeguarded. That is the Deputy Foreign Minister of a country that has blocked, backed by China, several resolutions within the UN Security Council. What can tip the balance in terms of these global superpowers blocking efforts to seek this diplomatic solution to what is happening in Syria?
If you want me to be perfectly honest, nothing. This is unfortunately the reality of 2014. We've seen a reassertive Russia. Vladimir Putin is clearly on the diplomatic offensive and on the strategic offensive, and what's been seen in Syria and Ukraine is part of a larger macro strategy, I think, from Russia to push back against perceived Western bullying tactics, which stretch back to what happened in Libya and our perceived overstretch of UN Security Council resolutions there. And I think Putin was extremely angry with the way that the West happened to behave on the Libya issue in order to get its own way to affect regime change there. On Syria, a line was drawn in the sand, no more. And I'm afraid that's how it's going to stay. I mean, the Russians might sound positive and may say that there are, that the process is ongoing. Well, yes, it's ongoing, but where is it leading? And I don't think a Russian foreign minister can tell you where it's going at this point.
Well, one slight shift in what has been a completely embedded process or non-process, would seem, is signs coming from Riyadh, from Saudi Arabia, of a new relationship potentially emerging with Iran. The invitation to the Iranian foreign minister from the Saudi foreign minister to visit Riyadh, very much a warming, perhaps, of relations. Could this have an impact on resolving the Syrian conundrum?
Some of Riyadh's calculations there are to do with the nuclear weapons issue and feeling a little bit outside the debate on that. Riyadh doesn't particularly want to face down Tehran by itself with perhaps Israel in tow, while the Americans in the P5+1 decide to negotiate some kind of agreement there. The Saudis have tried many different ways in Syria to assert their interests to remove Bashar al-Assad, and they're not working. I think the truth of the matter is that the Saudis just simply aren't willing to invest the type of blood and treasure that the Iranians are in Syria to see the conflict move their way. But so goes the rethinking now that perhaps they should start talking to the Iranians rather than stirring up sectarian problems and vice versa from Tehran. I've always believed that there's a sort of three levels to this conflict. There's the international conflict, perhaps where the global superpowers play. Then there's the regional powers, which is where Saudi Arabia and Iran play. And then there are the people inside Syria itself, the fighting groups, the regime, Jabhat al-Nusra and Dawlat Iraq al-Sham. So I think that, that particular discussion goes on at the mid-level, the regional powers, and it is important. And I think that to some extent, if there can be, for want of a better word, a détente between Saudi Arabia and Iran over Syria, it could lead to something more positive. But then you've got to then ask yourself, does that affect the players on the ground? Do people on the ground in Syria want to listen to what Iran and Saudi are telling them. My thinking is probably it's a little bit more personal than that after 3 years of fighting. So we'll have to wait and see where that goes.
Well, on that note, my thanks to Michael Stevens in London and to my earlier guests, Dr. Susannah Sirkin from Physicians for Human Rights and Dr. Zaher Sahloul, President of the Syrian American Medical Society. And you can follow this discussion online at facebook.com/AJ Inside Story or tweet us using @AJ Inside Story. I'm Mike Hanna. Thanks for watching and goodbye for now.